Hi, and thanks for this opportunity for me to share with you today our experience with district immunization system strengthening, particularly in Tanzania. I'm Lora Shimp, the Technical Director for JSI's Immunization Center. I wanted to provide you with some initial context around how we look at capacity building in the context of reaching every district, which includes these 5 areas of competency and opportunities for peer exchange. This is based on root cause analysis and situational assessments that also then enable for peer exchange, mentoring, and opportunities for coaching and review that enable peers to learn from one another while also reinforcing their skills. This also includes being able to look holistically at the competencies that begin with pre-service while also providing users at district level and the folks that they work with at facility level with the tracking systems, be they paper or electronic, that will help them to use data for their decision making as well as to change their behaviors as well as activities to improve immunization services. I will focus today on Tanzania. In particular, back in 2013, we were asked to work with several regions that were representing the highest number of children unvaccinated with Penta 3, representing approximately 40% of the country that had coverage under 80%. We looked at Kagera region in whole, but then also focused on Muleba district, where you see they had the majority of the population. They're a lake-based area that also has highlands as well as islands, so quite a diversity of population to reach. We did this work over the process of several years, both to help with their RED and REC situational analyses and root cause analyses, then through different opportunities for the capacity building that I mentioned previously over the years with the district immunization officers and their district health management teams. When we look at the motives, means, and opportunities, much of the foundation was already there in Muleba district as well as in Kagera region. They had the data, they have the opportunities for exchange through review meetings. However, they were not being tailored to the needs of those populations, nor were reports always up to date and able to be building on the micro planning for adequate budget allocation and expenditure information. They therefore did not feel empowered to make decisions because they weren't able to do the analyses themselves and have those opportunities to really use data and different opportunities for exchange to improve their own performance and change their own ways of working with their communities. When we began this process, and I want to emphasize process, this wasn't a magical project that came in and provided them with resources. They actually utilized the resources that they already had on hand, really looking at how to take very practical Excel-based micro-planning tools that included costing information and utilize the existing processes such as review meetings and opportunities for supervision and other means of exchange, including with non-health stakeholders in the health facility governing councils, such as community leaders and local organizations, civil society, and others, to help them to improve their services based on the review of their program. So as you can see, just in the use of this Excel-based tool, within 1 year, where we had challenges with funding for outreach, with the second gas cylinders that they needed to make the cold chain function for the storage of the vaccines, they were able to address that just in 1 year by having additional attention to the resources that they needed through this micro-planning tool. And as we see over time, even though our direct interventions were transitioned over completely to the regional and district teams as of around 2017, you see that the numbers of children vaccinated continue to increase. And we also see that it affected both Muleba district and Kagera region. Now, one of the issues that's important to address here is the denominator issue, which shows that although numbers of vaccinated increased, in some cases you had the issue of reductions in percent coverage because of denominator discrepancies. We also will be monitoring this closely. This is 4 months of data for this year, where we are starting to see some coverage gaps affected by COVID-19. I wanted to quickly share with you just a few testimonials. There's a video that you can see on YouTube, and these are excerpts from that video where we see the review meeting discussion by the district manager and how he has been using that to distribute vaccine, to also be able to have better transparency and communications among his colleagues, both at facility level and across facilities for his district reporting. Additionally, as this district medical officer will tell you, they also are able to now have more predictability in their data that links with their paper-based comprehensive council health planning that provides local resource mobilization and accountability, as well as the resources that they receive from the national level. Additionally, they are now able to use these plans not only to advocate for additional resources, but also to ensure that more children are vaccinated. Similarly, at the facility level, the tools and approaches are able to help empower the facility workers along with their health facility governing councils to be able to utilize their plans more effectively to ensure that services reach the communities. And likewise, community engagement with local community mobilizers is also part of this process, where they now also have access to the data to be able to help track children who are due for services and communicate with those parents to make sure that they come to the health facility and finish the vaccination schedule. This is also being done through an electronic system that now is rolling out nationwide in Tanzania, where much of this information is available through VIMS, the Vaccine Information Management System, for easy download by the district manager and immunization officer for them to be able to have more predictability in ordering vaccine, stock management, as well as for their coverage monitoring. Briefly, I wanted to mention that the approach that we have done here is not unique to Tanzania. We have also seen this with the Strengthening RI program in Uganda, where you see here, just by comparison of tally sheets and child registers over time in these districts, we see improvements not only in data use, but also in their ability to reach these populations. Similarly, in Ethiopia, in the UIFHS project, they have also over time with this district quality improvement teams at district health center and health post level, see increases in supervision visits, as well as improvements in the quality of immunization services to those populations. And these are very hard to reach rural, remote populations in Ethiopia, who oftentimes are not sufficiently reached with services. So the system level changes, they're the program needs that are aligned with this, and particularly behavioral issues around partnership with communities, as well as the service linkages that need to be done with communities. But we also have to acknowledge the human and financial resource costs that come along with this. You really do need to be able to do that rapid situational analysis and root cause analysis, not with a predetermined solution, but using human-centered design and tools that are able to be used on the ground by those who are delivering the services. Also, you need to utilize appropriate technology. As I mentioned, an Excel-based micro-planning tool, now linked with the electronic tool. It's a growth process where there has to be local resource mobilization and also the commitment of the government if you are going to transition this to a long-term electronic system, but it has to be user-friendly at a facility level if they only have, for example, mobile phones that do not have internet connectivity or data minutes. And lastly, the data culture and use has to be fostered and facilitated. Thank you for listening, and I look forward to talking about this with you further. Thanks.